2 readings, 2 votes, and move on. But in a time of emergency, this is the time when we need to move quickly. Citizens in Lubbock are scared to death. I know that we've been in conversation with all the mayors from Lubbock, Amarillo, Odessa, Midland, Angelo, Abilene, just to work together as a group, to bounce ideas off each other, and to look to move ahead. So last night, Mayor Payton and I spoke, and we decided it was time to go ahead and declare an emergency. So that's what we're here for. We purposely had our declarations very close so that we won't have a lot of confusion between when somebody in Midland talks, an elected official, and somebody in Odessa talks, an elected official. There won't be a lot of crossing up again. We want to make sure that it's easy for our communities to understand the needs and, most importantly, the precautions we all need to take. There's a lot of common sense in there. 2, social distance, make sure you're washing your hands. If somebody in your family is ill, please stay home for 14 days. The worst thing that can happen is if a child gets sick, the mother or father go to school, go to the work. This virus is 3 times more infective than the flu. That's what's causing this pandemic. If I went to each one of you and said, there's a flu pandemic, you're all going to look at me and go, oh, okay, no problem. But because this virus is new, we're still learning about this, we need to be careful and take the precautions we need to take. This moment, I'm going to go ahead and turn it over to Mayor Payton. I'll let him say a few words.
Thank you, Mayor. Well, thanks again for being here. And let me begin to try to dispel some of the rumors in the midst of the truth that we need to tell you. When you say what's going to happen with these declarations, first and foremost, we're opening up these declarations so as 2 cities, we can gain access to state and federal funds, and anything the state and federal government offers to us, we need to have these declarations in place. I'll back up and tell you, for several days we didn't think we were going to have to do this. We were doing research at the city level. We were asking people in Washington, D.C., we were asking them in Austin, can we not do this, and can we keep the temperature down in our communities? Really, we found out that that wasn't going to happen. We were going to have to go ahead and declare this to make sure that we stay in the line and things are available to us at the state and federal level. One of the things you'll notice inside these declarations is we are saying we do not want groups of 50 or more to gather in public places. Now, let me clarify a few things. There's a couple of, well, there's more than a couple. There's several exceptions to that. And some of those things are like malls or places of worship or grocery stores. And you may ask, why are there so many exceptions? Well, a lot of it has to do with movement of people rather than just tight groups gathering. And so we also want people to go about their daily lives, which leads me to the next point, which is understanding. We've said this many times, but after you hear this press conference and after you hear this news, the worst thing you can do is hurry out to Walmart or Sam's or H-E-B or your favorite grocery store and think that we've entered another stretch of danger and emergency. We haven't entered a new stretch of danger or emergency. What we're doing is preparing just in case we do. Not much has changed around here. We still do not have a confirmed case of coronavirus, but we're having to put in place as mayors that which is necessary so we can do for our communities the things we need to do. We can access what our communities need to access. Now let me give you another reality. The reality is we have been asked by multiple people, and I will even say we've been asked by healthcare professionals to be even more restrictive. I can't count the number of emails that I've received that say, could you please just shut down restaurants and bars? Could you please just shut down the community? And both of us know that our communities have been absolutely hammered by what's happening in the oil and gas market. And then you have what's happening here related to the coronavirus. And quite frankly, we're not willing to bring our communities to their knees. But that requires of every single citizen that you listen to the fact that this is very serious. We know how we are as West Texans. We absolutely think that we are immune to anything. We actually think we can probably just rub some dirt on it and the coronavirus should go away. But the fact of the matter is, it is serious. As the mayor told you, we just learned from the White House this afternoon, the coronavirus is three times as infectious as the common flu. We probably, I don't want to scare anybody with this comment, and you're going to have to make sure you don't overreact, We probably have the coronavirus here in the basin, even closer than we think. But we're still waiting on testing to ramp up, and we can't take chances. We can't continue to just think we're immune to this. So what we're doing as mayors is stepping up with these declarations. We're saying we do not want you in groups of 50 or more. You shouldn't be out promoting something of 50 or more. There are exceptions, again, that you'll be able to read later on when you get a copy of the declarations. You'll be able to see the exceptions. You'll also be able to see that this is not as strict as we could have gone. This is not as extreme as we could have gone. Now, a third thing or fourth thing, whichever one it is now and all the things I'm telling you, our city councils have the opportunity in the next 7 days to say they don't want this to continue. Or they can increase it, they can modify it, but we're taking what we have at our disposal, we're putting this in front of our cities for the protection of our cities, and we're asking our city councils to come back in 7 days and take a look at this. I want to reiterate, we are not elevating quite literally beyond where we already are. I know the mayor and I have talked to restaurateurs. We've talked to them about limiting the space inside their restaurants. We've talked about drive-thrus. We've talked about grab-and-goes. Nothing changes with our ECISD and MISD, which, let me just pause for a minute and say, our school districts have done an absolutely amazing job taking care of our communities and taking care of our children, and they should be applauded for the hard decision that they made. But what we're doing right here in Midland, Odessa, is being aggressively proactive as much as we possibly can right now without pulling the last trigger to get even more extreme. What we don't need you to do as Odessans and Midlanders is to go into some form of panic right now. I know what you're saying, but wait a minute, you're doing this. No, don't change what you're doing, because I already see what you're doing. The mayor already sees what you're doing. You're not going to the stores as much as you possibly could have and clearing the shelves. I've already seen the lay down in the traffic. Keep doing what you're doing, but take it seriously. And if you're tempted to make this a joke and to say this is blown up around the country, it's not a joke. As I listened to the president's team on a conference call at noon today, things are getting very, very serious, and we're one of the least affected regions. And if we want to stay that way, then we have to remain disciplined and vigilant about what we're doing. And with that, unless you have anything else to say?
One of the things being in the restaurant industry, looking at what they're doing around the country, the state of Oklahoma has clamped down everything. They are closed all their restaurants except for pickup or delivery. What that does to your community is lays off a lot of people that won't have checks, people that won't have money to go buy unless the federal government does something. The federal government is looking at doing some things. But that's to give you an idea of some of the things we hear. And we have to hear it and apply it to our community. And at this point, we feel that these are the best options for our community. But like we tell everybody we talk to, we just got to listen to the people that need to be listened to. If you're listening on Facebook, you're watching on Facebook, great. Don't believe everything you read on Facebook. Because too many people are saying, well, there's a confirmed case here. If you didn't hear it from the health department or a trusted news source, it didn't happen. And that just ramps it up a little bit for people. So
it's an opportunity for Midlanders and Odessans. We say this all the time. You saw it this summer. It's just another opportunity for us to realize what's most important. My final message before we take questions is to those of you who are healthy and younger, for those of you that are in your 20s or your 30s or your 40s or your 50s, am I going too fast? Okay. Or if you're still healthy in your 70s or 80s, here's the issue. Take care of your neighbor. You're not taking care of your neighbor when you go to the grocery store and you get the last of everything. If we will just act like we know we need to act, take care of each other. Make a joke out of the fact that you're bumping elbows now instead of shaking hands. It's not a joke to carry around alcohol gel and wipes and make sure you're being clean. It's not a joke that if you think you're sick, you need to stay home. To take seriously that your employer is telling you you need to stay home and work. It's time for us to take this seriously, to take care of one another. And I campaign, and I know the mayor's just thankful he didn't have to campaign, but when I was campaigning, I said, we one day want to be one of the top 100 cities in the nation. I didn't think this is how we'd get there by our example of how we behave ourselves in difficult times, but we can be that region that shuts this thing down if we'll take it as seriously as it needs to be taken. So with that, questions?
sounds good.
Questions? Right here.
What do you say to people who hear this message and they think you're putting the economy before public health?
They think we're putting the economy before public health or public health before the economy.
That they hear this declaration and believe that you put the economy before public health.
Well, you'll see in the declarations we recommend that people follow the CDC guidelines, that we hope they will go ahead and self-regulate to that point. But one of the key principles here in the Permian Basin is we believe that business. So we're very about what I said a little bit earlier, and that is bringing our economy to its last leg and to its knees. When oil-producing regions in this country are now looking at what happened at the close of the business day today with oil being at $20 a barrel, and when people are looking at their employees, we believe we're not putting the economy before public health. We believe we're asking the citizens of our cities to think about health and to save our economy without us having to go to extremes.
You know, I've met with pastors, I've met with everybody, and I talked to a group of pastors, and the pastor said, we're 2 Sundays from closing our church. They believe you have to put in, they don't do online, and they're saying do what you can to help us. One of the most powerful things we have is prayer. I firmly believe that when the churches are praying, things get better. I know a lot of people are going to say, well, you need to close all the restaurants down. I've been on at least 15 or 16 calls. I know the mayor's been in the same. We're listening to what they say, but part of being a leader is differentiating the information, picking out what you think the best path is and going forward. Now, will we change it in a week? It could change in a week because we know how fast cases can be brought into community. And that's what we're watching. But you also have those people that aren't going to eat if they don't work. And it's a balancing act. So we have to balance public health with the best for the public. So
We'll just keep going that direction.
You mentioned already that you're not going to close down restaurants, etc. Does this thing apply as well to bars, coffee houses, any non-food service establishments?
Yes, you'll see within the declaration, we're not shutting down bars. We're just the emails of people saying, would you please shut down restaurants and bars? But here's what we're asking restaurateurs and bar owners to do. Pay attention to the crowd. Make sure that people are not shaking hands. In fact, you might want to put a sign on the door that says, don't talk to your neighbor at the bar, which wouldn't be a very fun bar at this particular point. But we're not shutting these things down. Could we shut them down? Yes, we could. But the reality is and bar owners pay attention to the CDC regulations and keep us from having to make that drastic decision. Now, will it change? As the mayor said, things could change. We might get some news in the next couple of days about a coronavirus positive ID here, and we'll have to reevaluate where we are. But again, we're taking the chance and we're taking the risk to ask our business community, take this seriously with us and for us so that we're walking down this path together.
I've had phone calls from restaurants. I'm in that industry, I understand it. And I'm telling them, look, what you need to do, space out your tables. If you have tables, make sure you have sanitizer for the customers coming in. Make things like that. Restaurants, they have to do to protect the business. And like I said, you know, things can change overnight.
Absolutely. Just keep going.
And make sure I understand this correctly. You guys are recommending that these businesses, restaurants, they not allow more than 50 people or else like suspend operations, but is this enforced in any way?
No, we're not going to enforce it. Now, we can enforce it. The mechanism to enforce for us as municipalities, if there are more than 50 people in a gathering, in a close gathering, that mechanism is there. Are we going to send our police and firefighters out on 50-person patrols to go look at the community? No. But we're asking you to please respect this as it is in resolution and take care of your patrons in that regard. I've talked to restaurant owners who have said, listen, we don't have a problem with spacing the tables, with looking at our dining room, seeing we've got 48 people in there and telling people we'll call you back just like a reservation would be. And so we're trying to do everything we can to help in that regard. But you're correct that it's in the resolution, and but we're not going to go around searching for people.
Okay.
Next question.
Why can't we get the test results? Other places, have the positive and the negatives. I was just just wondering why we don't.
One of the questions that's been posed, and one of the answers that I received from the health department, is if I come out to you as this group and say, we've got 50 tests going at one time, what are you going to do? Panic. You're going to think, oh my God, we've got this many people that are sick. If we come out and say we've got 20, they're all coming back negative. Does it really matter how many we had? Because what's going to count are the ones that turn positive. That's up to the county health, county. But that's one part of the reason why that's being done.
Well, the other part, if I can look at the CDC and with the White House today, is we've narrative about testing is this testing is standardized and testing all over the country, and that's just not true. The federal government, the CDC, and the health department have been continuing to improve upon testing. We just heard today there's even another new type of test that's coming out. And to be very blunt with you and efficient with you about what's happening in West Texas, because we're one of the country when it comes to access to those tests. We're actually getting those things later because we're less expensive right now. That's available. An overrun, and it has delayed the results of getting back to those. So it really is just a matter of an overrun of the market related to testing, and now that's even changing. And to add to that, we're also hearing from the federal government that because testing is getting better, what we're concerned about is we may see even more cases now because tests are better. And so, again, tomorrow, we'll even have another answer for that question because of how testing will change by tomorrow and by the next week. So we have lagging indicators, which is why it's so dangerous for our cities to think, oh, we're good, because the indicators are lagging. And even if you look at the graphs from the CDC and other clinics, they'll say our test results are lagging behind. So don't take that we have 0 cases today as we have 0 cases.
And many times with the cases, we are going to get more of the quote kits. There's a shipment that's down in Fort Stockton that will be distributed to the Permian Basin. But one of the problems is if we send it to Lubbock, they're open 5 days a week. Well, if you send it off on Friday, Saturday and Sunday they're not looking at it because they're limited in staff. So it could take 4 to 5 days to get it, depending upon when it's sent off. Yeah. And so we just don't want that lagging, oh my God, here it comes. So.
Let's go back around and we'll just keep going back around.
You said the results are lagging. You said that the coronavirus may already be in the basin.
Mm-hmm.
If you believe that, why aren't you taking more precautions to limit the spread?
Because I think we're taking the adequate precautions we need to take. Same answer I gave you at the beginning. I think we're being as extreme as we can possibly be at this point. And if we have to move further down the line, we'll move further down the line. So I think I'm very comfortable with the decision we're making and with what level of extremity we think we're at. And so we'll stay there until we get another sense that we need to ramp things up.
I still understand why we're not being more transparent about like the number of tests that are being done in the area. New Mexico is like keeping up with like all the testing throughout the state. Mm-hmm. Why not be more transparent with the people so they know exactly how many test kits are available in this area, how many people are being tested, and then tell them the results, of course, as they come. But make sure, as you're saying, you don't want people to panic, but just simply tell them that there are people being tested and there are proactive efforts out here to make sure that you guys are screening people and figuring out whether or not people here who do have the virus or not.
You want to go ahead?
Sure. And part of it is this whole thing is moving. I mean, what we get in a phone call today can be totally different than what we get tomorrow because the state and feds are learning as we're going. One of the things, that is just an individual decision that's up to that entity. Right now, Ector County has decided not to. Do I think they might change? Yes, they might change. I'm talking to them about it. We've had some others. But at this point, they feel that is the best moving forward because right now, everybody, it's like you're standing on a cliff and you're just looking for something to push you over. And we need some help manage that message. Yes, by getting on Facebook, talking to the communities, sending out things on Facebook. It's just how you manage that message not to create more panic. Because, if we, like I said, if we told you we had 50 tests out, you're going to think, well, 1 out of 50, that's going to happen, and then it goes out. Because you have to realize, different levels, different education are going to interpret things different. And so, but we will discuss that with Ector County.
Well, I think I would press against the idea of not being transparent. We're being transparent as HIPAA and other things allow us to be related to hospitals and what they're telling us. The fact of the matter that people are being swabbed or being screened, first and foremost, means they had to meet all the protocol before they even got there. That's why so many people say, I want to be tested. Then they get mad because they don't get tested. And the reality is those things are happening, and we'll be transparent with the numbers as we have been very clearly to say we have no confirmed cases of coronavirus here. People are being swabbed. As to how many of those tests are going out, we're restricted to how much we can report on that, but we're in contact with the county, and we're in contact with our hospitals to find out what those answers are. And when we have them, you'll be the first to know.
What if the guidelines are preventing you guys from telling us how many testing is happening, because New Mexico is doing this?
Mm-hmm. What I have heard from our hospital is there are regulations related to HIPAA that keep us from doing that, and so that's the only answer I can give you in that regard.
Specifically what regulation that is?
I can't point you to 1.243 in the book.
Sure.
I can just tell you that's what they told us.
Yeah. Other questions?
So, like you said, this is more contagious than the flu, so that means it can spread fast.
Mhm.
Are there any precautions or efforts being undertaken by the cities or the hospitals to expand the beds that can house patients, to get more ventilators, to prepare for an outbreak when it comes to Permian Basin?
I've been in contact with Brooks Landgraf. He is actively working on that. One of the concerns is because we have been so slow to bring this into our community, that the I-35 corridor may absorb most of them. Most of the private market ones are taken. Any hospital that has one's not going to release it. So they're looking towards the military to be able to use some of those. They've also asked the companies that make ventilators to ramp up production, and there's going to be a little bit of a lag. I know we posted how many ventilators are in Ector County at both hospitals. And part of it is just, it's like you see with N95s. They're out there. You just got to try to find them. And that's what Brooks Landgraf is working on.
And what about beds, expanding capacity of hospitals?
There's actually an extra room, or actually floor at ORMC that they've offered to open up if they need it. And so we're just watching the counts in the hospital to see what's going on.
Yeah, and Midland Memorial is operating under the same pretenses, also understanding that even from the federal government today, they are asking, well, they're mandating no elective surgeries. That includes even dentistry. And so what we're doing in the first is not trying to add before we find out how much we can take out so we have that available. And the other thing that's going to help us to continue to ramp this up is the fact that young people and those who are healthy don't automatically think they need to go to the hospital and think they need to be admitted, which causes me to remind you, because of your question, again, we are not ramping up anything we haven't already told you to do. We're just making it more serious. And so it's important for you to understand the process if you think you might have the coronavirus. Number one, you probably don't. Number two, if you have a fever, if you have a dry cough, if you have respiratory problems, then call your primary care physician. Don't run out of your house and run to the doctor's office and run to the hospital. Call your primary care physician or call 68 nurse and follow the instructions. The other thing to tell you is follow their instructions. Don't tell them the instructions you want them to give you. They are the health professionals going through a protocol. And so when they get through the protocol, then it'll be determined whether you're tested or not. And as mobile clinics ramp up, which they already are even around here, you'll be told you can go to a mobile clinic. It's not Chick-fil-A. You don't just get to order your test. You have to figure out, they have to determine if you meet the protocol. And then you'll go through the testing process. I cannot emphasize enough. And I know what you're going to say to me. You're going to say, yeah, but you're doing this. How can we not panic? The worst thing you can do is go into panic mode here. We are in uncharted territory. This entire country is in uncharted territory. In Washington, D.C. today, they said we are in wartime footing. And the fact of the matter is what we have to do as one of the one spots in the nation least affected by this is we have to go to some extremes on our own to prevent some of the extreme things happening that are the basis of questions being asked. So we're asking you to understand what we're doing. Remember, the primary reason for these declarations is first and foremost to make sure we don't miss out on what the state and federal government can make available to us for aid. And secondly, to remind you it's very, very serious, and let's take it seriously before we have to get even more serious about it. Any other questions? Two more.
I'd like to go back to the whole shortage of groceries and things like that. We know that individual stores are doing things, changing hours, etc. Is there anything that city governments, county governments, even law enforcement can do to penalize the people that are going in and stockpiling and hoarding and all that stuff? Or is that something beyond your scope?
It's a little bit beyond our scope, but I know some of the grocery stores are being proactive and saying when you walk up to the counter and you have 4 bottles of Lysol, I don't know which one it is, and they're going to take that off your basket and say you can't take that. So I know some of the grocery stores are doing that already. Part of your question, I don't know if it is, but I also listened to the USDA today that said our supply chain is very, very good. It's very, very healthy, and it will stay healthy if we can minimize this hoarding issue. So the USDA assured us today that the supply chain's healthy. I know that HEB and others have been limiting what people can buy, and so we just need to stick to that and not fight over that.
And part of it is we are simply in, we've heard it a lot, unprecedented economy. The August 31st shooting, unprecedented for West Texas. We're in those unprecedented times again. You're seeing stores taking the steps to protect certain parts of the community. HEB opening up for 60 and over. Fantastic, because a lot of those older people aren't quite as quick as the young people, and other young people are grabbing things. Things like that are fantastic, and we applaud them for that. But part of just down to the basics of this, as Americans, we love our freedom. Freedom was bought for with blood. And now all of a sudden we're being asked to not quite be as free as we're normally free. But that is simply for public health. If we do not take these steps, it could get bad. But if we can all do this, we can take care of it and we can get through it. And part of the reason we put the fine in there, 99.9% of the people are going to do exactly what we ask. They're going to social distance, but there's always those 1 or 2. And that's why we put a penalty in there that says you're not going to endanger this entire community because that's what you want to do. And so we have to do things like that.
One more, right here.
How do we know if we're less effective if we don't know how many have been tested?
Well, it goes to the fact that we are testing. And we are testing enough to be able to tell you that among those being tested, we have no cases of coronavirus here. At the same time, we're ramping up alongside the federal government and the state to make sure we have even more testing available, and so we'll be able to know even more accurately what that count is.
But so many times, right now, every weed in West Texas is blooming. So if you have allergies, you have symptoms. The flu is still going on. We have to let doctors sort through that to make sure, yes, okay, you've got the flu. You don't have the coronavirus. That's why they're asking the questions. If you call 911 in either city, they're going to ask you questions. Do you have a cough? Do you have a fever? Because they need to know where to take you. I know in Odessa Medical Center is probably going to open up all of their clinics to help be able to take care of the numbers of people that are calling.
Okay, thank you for your time, and that'll conclude it. We'll stay around here for a little bit, but thank you for your time.
Before we go, I have one more that's important. I've got a screenshot from the Texas Health Department, and they have the breakdown of the number of tests they've issued in the state. It's 1,907. They have it broken down by public and private labs. I'm still not understanding why we don't know the number of testing that's being available in the county when the state itself is being able to release these.
Because I don't have the answer to that question.
I understand.
I don't have the answer. And you can keep asking me that question 42 different ways, but I don't have an answer to that question.
But could you get it to our offices?
If we can get that number accurately,
Okay, they can do individual interviews, but the press conference part is over.
you sent it to them yesterday? Okay, so you have an answer, you just haven't found it.
Good job.
You're welcome.
Wanted to thank you for everything you guys are doing. I know it's not, maybe it can be hard.
Yeah.